Welcome to my illustrative presentation. My name is Nancy Warnell. This is for class LTech 4121. Today's presentation is entitled Tools of the Trade, Supplies You Will Need for Doing a Phlebotomy. Let's go do our icebreaker. Good morning. This is my illustrative presentation, and we're going to start with an icebreaker. I'm going to give you some facts about about you guys that you gave me, and y'all can decide who is who. Okay, who in here wears a child-size shoe?
Jessica.
Very good. Who had a dog throw up in their bed and they were so tired they just rolled over and did not clean it up until the next morning?
Patrick.
Who went to 12 different countries in the span of 1 month?
Sam. Oh, yeah.
Very good. Who had a fifth bone surgery on her leg, and it was a textbook procedure, and she had a case written up about her?
Sarah.
Yes. And who was in special ed from elementary to sophomore years? Very good. All right. Y'all know each other pretty well. Okay. So, again, I'm Nancy Warnell. I'm the lab manager here at UNT's Student Health and Wellness Center in the laboratory. I've been a medical technologist for 39 years, and I train the phlebotomists to draw. I train students to learn how to be phlebotomists. And I'm very experienced at phlebotomy procedures. So today we're going to talk about venipunctures. Venipunctures are blood draws in the arm. Okay? They're not heel sticks, they're not finger sticks. Really, we're not going to talk about hand sticks either. We're going to strictly talk about venipunctures and the supplies needed to do those. We're going to talk about tourniquets, needles, hubs, syringes, butterflies, vacuum tubes, and band-aids. Okay, the first thing is tourniquet. And from your handouts you can see tourniquets can be either latex or latex free. You never know unless you order them yourself what they are, so you need to make sure that you know if you have a latex free tourniquet. All of our tourniquets are latex free. Okay, people with latex allergies will probably tell you that they have a latex allergies, but you should always ask. Needles. This is a vacuum needle, and you can see that I have shown you a picture of actually how the insides of this work. The bottom part screws into the hub. This is the needle protector. You take this part off, and when you're through, you literally close it so that you don't get stuck. Wearing gloves will help prevent blood from getting on you, but it will not protect a needle from sticking you. So be very, very careful. There are some hubs, this part of the device, that actually have this protective sheath attached to them so that when you put the needle in, it's actually on the hub. You must use one or the other. They don't sell just needles without the hub with the protector anymore. That is an OSHA regulation. Okay. Syringes. Syringes are used when the vacuums and the vacuumers are too strong on a vein and will collapse the vein. And we have several different types of syringes here. And this is a 10 ml syringe. And this does not come with a needle. Now some syringes actually come with needles. And when you talk about needles, what you have to remember is the bigger the number, the smaller the needle. So a 25 gauge needle, which is what this says this is, versus a 18 gauge needle. Do you see the difference? Okay. Okay, so my first question is, I have a 29 gauge needle and I have a 30 gauge needle. Which one's going to be the bigger?
30. Oh, bigger, 29.
Okay, let me show you. This is the 29. This is the 30. Nope, this is the 29. This is the 30. Wait, this is the 30. This is the 29. And what we're talking about is the inside circumference of the needle. Okay? You see the difference?
Wrong. Get one from Davis.
Put this back on here. I'll edit that out. Thank you. Okay. And here are, I showed you those already. Okay. So now we're going to talk about, by the way, these needles right here will never be used to draw blood. And why is that? Why would you never use something this small to draw blood?
It would never flow fast enough?
It would hemolyze, right. The bevel is too small and the cells would rupture inside of it and it would be hemolyzed. And hemolyzed blood is not good to test. So that's why we have a set standard of what size needle to use for phlebotomy. Okay? Okay, butterfly. This is a butterfly attached to a syringe. This is called a male or female setup. Okay? Female setup screws into a syringe. A male setup you use on a hub and it screws in. So this is a male setup. Y'all use the male setup because y'all don't use syringes. Okay? When you use a syringe to draw blood, let me show you on this one. And you use a female setup, it screws on, and when you pull, you don't want to pull hard because it's too much suction and it'll collapse the vein. Think of it as a rubber tubing. You stick this into here, and if you pull real hard, it's going to just suck it down. So that's why you use a syringe, because you don't want to do that. You want to go very, very slow. This is not the ideal procedure for doing CVCs, and the reason is why.
Because you need to turn the blood so it doesn't clot.
Exactly. It will clot in here by the time you finally get it into the tube. Okay, because there's nothing in a syringe to keep it from clotting. Pretty good, Patrick. Okay, so this is another demonstration of a vacutainer. Of a butterfly. Let's see. We open this. Well, we get scissors to open it. Don't care. Any male device can be made into a female. You cannot make a female into a male unless you have it. Okay, now we're going to talk about vacutainer tubes. Vacutainer tubes have a built-in vacuum which sucks the blood out of the vein. Okay, they're very colorful. They have all different kinds, and we're going to go over these. We have gray. Gray is usually used for glucoses, especially if you have a tolerance. Okay, it has sodium fluoride in it. Okay, sodium fluoride is the white powder that's in the tube. We have green tops. Green tops come in either lithium heparin or sodium heparin. Usually labs use lithium heparin for general chemistries, but you cannot use a lithium heparin on a lithium draw. And why is that?
Mess up with the read.
It would interfere with the test, yes. The lithium in the tube would interfere with the lithium results. So that's why lithiums are always drawn in a red top tube. Okay, because you don't want to ever mix it up. Okay, this tube right here is a clot activator tube. It has special stuff on the side, and it activates the clotting so that it's essentially a red top tube in your logo. It has gel at the bottom, so when it's spun and separates, you have cells down here and you have serum up here. When you have a clot tube, the top is serum. When you have an anticoagulant in it, the top is plasma. Okay? Again, another red top tube, and it also has a clot activator in it. You can see it on the side of the tube. And it has gel on the bottom. So when it's spun, it is cells and serum. Okay, a blue top is for coagulation studies, proton, PTT, fibrinogen, FDP, and it has a liquid in it. And these tubes have to be filled to capacity. You can't overfill them. It's 2.7 mils. And it has buffered sodium citrate in it. Okay? It's no good spinning these tubes before you send them out, because there's no gel on the bottom to separate the cells in the plasma, so we just leave them as whole blood, and they'll spin them when they get ready to test them. This is another red top tube, and it also has a clot activator in it. You can see it on the side of the tube, and it is cells and serum with gel in the middle. EDTA. EDTA is usually used for CBCs, blood typing, hemoglobin electrophoresis, and sickle cell. It also does not have any gel on the bottom, so it is whole blood. Okay, this is what and that's why it's very important to make sure you mix a purple top tube, because it cannot clot. All these tests that I just mentioned are done on whole blood. And then this is the same as this one. Okay. Other supplies that you will need when doing a blood draw are Band-Aids. Now, some Band-Aids have latex in them, and so you want to be very careful that they don't. These are latex free, but if you work in a place that you don't have latex free Band-Aids, you have Coban. Coban is latex free, and it's just a stretchy type of tape. You put gauze on your hand, on where you drew them, and then you just wrap this around them. I'm going to pretend like this is my drawing side, and it sticks to it, and you can apply pressure. Okay, and then they can just take it off when they're through clotting. Okay, and then also you will need alcohol to cleanse the arm, and gauze to wipe the alcohol off. Are there any questions? Any comments?
Okay, I'll ask you a question.
Okay.
Have you ever had an experience with a patient who didn't know that they were latex, they had that allergic reaction to it, and then once you
Yes,
put it
I
on there?
actually have. A patient had a latex allergy. They did not know they had a latex allergy, and when we put the tourniquet on them, they swelled up, they got red, and then we had to take it off real quick and call the doctor to get some Benadryl for them. And from then on, we tell them you are latex, you know, allergy to latex.
How has your experience in a hospital helped you with your practice overall?
Well, in a hospital, you have a variety of patients, not just healthy ones, and not just babies, and not just old people. You have everybody. So you have to draw babies, sometimes venipuncture, sometimes heel sticks. You get ER traumas come in. When I worked in New Mexico, I worked in Alamogordo, which is at the base of the mountains, and there were so many traumas that came in from MBAs, and you just can't believe we had one kid that came in who had been shot in the head right here by a friend, and it was awful. But I had to go down, and because they were going to donate his organs, I had to draw all this blood on this patient. It's very emotional to have to do that. When I worked at Cook's, I was drawing a newborn, a neonate, and the baby died while I was drawing him. And it was really sad. The nurse wasn't as upset about it as I was. I just went back down to the lab and just cried. And she said, well, I guess we won't need that lab work now, you know. So there's been, working in a hospital is very emotional because you get a gamut of all kinds of traumas and things that come in. When I worked in Denton, I had family that came in. You know, I had to draw my family that lived up here in this area. Actually, it was my husband's family, but still, I knew him, and it was very, very difficult to do that. I'd rather not know. That's why I'm not a nurse. I don't like patient contact, you know, really. I don't mind drawing people, but I don't want to know who they are. And then I just take their specimen back and work on their specimen. So that's the kind of, working in a hospital enriched my phlebotomy skills so much, because you just have a whole gamut of what you have to draw and the circumstances of what you have to draw. When I was in New Mexico, there's Indians, and we had a hemophiliac come in who was also a drinker, and I had to draw blood as they were putting blood in, and it was they used all the blood on the shelf for this poor guy, and he ended up dying. So it was pretty traumatic, and I was the only tech on there at night in New Mexico. So it's very you have all kinds of experiences with drawing people, and so it's very enriching. Any other questions?
How do you tell if the vein is going to collapse on you, or if it's
You
too
don't.
fragile?
You can only if it's a little bitty small vein, you see it, but you really can't feel it. Does it give you a clue that it's going to collapse? And when you draw a sample and all of a sudden it bevels up, that means it's perforated. That means it's bleeding on the inside. The needle is not really in it good enough to get the blood out. It's just it's like you pricked it and it's just bleeding. And so you need to get the tourniquet off, get the needle out, and hold pressure for a long time to get all that blood down, because that's where you're going to get a really bad bruise.
For the blue top that we draw the prothrombin times on, why is it so important that it needs to be all the way full?
Because of the liquid that's in here, it has to be a ratio. There is a set amount of liquid in here. You see the liquid? Okay. If you fill it too much or not enough, then the ratio of the liquid to the blood is off, and then the results are off. And when they do a pro time, they actually report a number and a percent, and that percent is what is a standard amongst no matter who does the test. They want to make sure that their INR, which is a value that is calculated from the pro time, is they can go anywhere to get a pro time done, and that number will stay the same. So that's why it's important. Any other questions? Okay.
So what would you say is your favorite needle to use, like the one you feel is the most easiest, that your go-to needle?
My go-to needle is the green one. This one right here. I don't particularly like the black one. The black one is the same gauge. It's just longer. And I trained on green tops, which is a specific length, and that's what I'm used to. So when I get a black needle, it's like, am I in too far? Am I not in enough? Because I can't gauge it from the length of that needle. So I like the green ones. Any other questions? Okay, well, thank you so much. Okay, well, thank you so much for attending. There is food in the office for you, and I do have a handout for you and an evaluation. So if you would please fill these out and give them back to me, I'd appreciate it. Thank you so much.